Millions of people have knee replacement surgery every year to improve their knee's function. But a question many people never think to ask is, does a knee replacement actually improve the knee's motion? In other words, does surgery make the knee bend and straighten better than it did before? The answer is, not always. In fact, the people who have the best motion before surgery are often the most likely to lose motion after surgery. I know that's not what anyone wants to hear, but that's exactly why we need to talk about it. Because the truth is, some of your knee's motion is decided before you even have surgery, but not all of it. And the part that you can control is bigger than many people realize. So, knee replacement can improve your knee's motion, but can also worsen it. To understand why, we first have to answer a more basic question. Why does knee replacement change your knee's motion at all? People often think that surgery just swaps out the bad knee for a better one, and the motion comes along with it. But what's actually happening is more like a tug of war. There are forces from the surgery that pull your motion up, and there are forces that pull it down. And where your motion lands depends on which side of that rope wins. Let's start with the side that pulls your motion up. There are three main ways that knee replacement improves motion. First, it clears away bone spurs that block the knee from moving. Bone spurs, which are also called osteophytes, are growths of bone that build up around an arthritic joint. They can act like a doorstop wedged under a door, physically stopping it from moving all the way. When we remove the bone spurs during surgery, we take that doorstop out, and the knee is free to move further than it could before. The second way knee replacement improves motion is by loosening tight soft tissues. Over years of arthritis, the ligaments and other tissues around the knee can become tight and contracted, almost like they've shrunk down and stiffened in place. During surgery, we can carefully release some of that tightness, which gives the knee more room to bend and straighten. And the third way knee replacement improves motion is by rebuilding the joint's worn-out surfaces. By the time you need a knee replacement, the smooth cartilage that lets your joint glide is usually damaged or worn away, leaving rough, grinding bone. The implant replaces those damaged surfaces with smooth new ones, so the joint can move more like a healthy knee again. But here's where it gets interesting, because that same implant doesn't just pull in a positive direction. The implant can also limit motion. As good as modern implants are, they aren't a perfect copy of the knee you were born with. The exact shape, size, and alignment often aren't perfect replicas of your natural knee down to the millimeter. And that can put a limit on how far that knee can bend. So that same implant that gives you a smooth new surface can also hold some motion back. But that's far from the only thing holding your motion down. In the weeks after surgery, inflammation works against you too. Inflammation leads to pain and swelling, making it difficult to move the knee. And a knee that doesn't move tends to stay stiff and inflamed. It's a frustrating cycle, and it's a big reason why those first weeks can feel so hard. Over time, inflammation promotes scar tissue formation, which is the third way knee replacement can reduce motion. As your knee heals, your body naturally lays down scar tissue. That's a normal part of healing, and it happens to everyone to some degree. But in some people, the body forms more scar tissue than it needs to. That tissue hardens like cement inside the knee, limiting how far the knee moves. So that's the tug of war. On one side, removing bone spurs, loosening tight tissues, and resurfacing the joint can give you motion. On the other side, the implant's limits, inflammation, and scar tissue can take some away. So which side ultimately wins? Whether you gain or lose motion largely comes down to your knee's motion before surgery, but not in the way you might think. Patients with stiff knees with less motion before surgery are actually most likely to gain motion, and patients who have flexible knees before surgery with a lot of motion are actually most likely to lose motion. Now, that may sound backwards to you, so let me explain why that happens. Think about a stiff knee first. A stiff knee usually has trouble moving because of the bone spurs, tight tissues, and worn surfaces holding it back. And those are exactly the things that a knee replacement is good at fixing. When we remove the bone spurs, release the tight tissues, and resurface the joint, we often free up a lot of motion that was trapped in there. There's so much to gain that it outweighs the things that are pulling the motion in the other direction. In other words, stiff knees usually end up with more motion than they started with. Now, think about a really flexible knee. That knee already has a great setup. It has tissues with just the right give and a joint that moves through a wide range. The problem is, that's a hard act to follow. Even a well-made, well-placed implant can't perfectly copy what nature already had working. On top of that, the healing process lays down scar tissue, and you can see what the problem is. For a flexible knee, there just isn't that much to gain. but there is some to lose. That's why flexible knees often end up with less motion than they started with. But notice that even though the flexible knee lost some motion after surgery, it still ended up with more motion than the stiff knee that gained. This is one of the most important facts when it comes to knee replacement motion. Knees with better motion before surgery tend to become knee replacements on the more flexible end of the range, even if they lose some motion from the surgery. And knees with worse motion before surgery tend to become knee replacements on the less flexible end of the range, even if they gain some motion from surgery. And so there's good news, no matter which group you're in. If you're starting with poor motion, your odds of an improvement are high, because your knee has the most to gain. And if you're starting with good motion, you're likely to end up with more motion than someone who started stiff, even if you do lose a few degrees. Either way, you have something working in your favor. Now, keep in mind that these changes are what tend to happen. They aren't guarantees. Some knees don't follow the pattern, and your own results depend on a lot of individual factors. But on average, the pattern holds, so it's a useful guide for what to expect. So you may be thinking, what group am I in? Can you get a rough sense of whether you're in the stiff or flexible group before surgery? You actually can, and studies point to some rough cutoffs. If your knee bends past about 130 degrees going in, you're more likely to lose a little motion from the surgery. And if it only bends to 110 degrees or less, you're more likely to gain. If you're interested in measuring your motion yourself, you can use a goniometer like what you see here, or you can use a smartphone inclinometer or goniometer app. Your surgeon or physical therapist can also measure your knee's motion for you. On average, knee replacement improves knee motion by 0 to 10 degrees. That might sound smaller than you'd expect, but remember, that's an average that blends everyone together. The patients who start out really stiff can gain much more than that. The average lands where it does because the flexible knees, the ones already near the very top, pull it back down by losing some motion. So, what can you do with all this information? If your knee's motion before surgery drives its motion after surgery, does improving your knee's motion before surgery give you an edge after surgery? Well, it isn't that simple. Exercise before surgery, including physical therapy, can absolutely help recovery after surgery. Studies show that it can help improve range of motion early in the recovery. But when researchers look at whether it increases final motion in the long term, it's not clear that it makes a big difference for most people. This means that your motion before surgery is more like a gauge than a lever. It shows us where your knee is likely to end up, but it often isn't something you can pull to change the outcome much. So if the lever most patients can control isn't before surgery, where is it? It's after surgery. Think back to the three things that take motion away: the implant's limits, inflammation, and scar tissue. The first one, the implant, is more or less out of your hands, but the other two are exactly where patients have real influence. To limit the effects of inflammation, the goal is, of course, to keep that inflammation low. There are two main ways to do it. The first is cold therapy, whether that's a simple ice pack or one of the cold water devices that wraps around your knee. Studies show that cold therapy helps improve range of motion early after surgery, and it tends to help the most when you start it early and use it around your physical therapy sessions. The second way to lower inflammation is with anti-inflammatory medications. These work by lowering the inflammatory signals your body produces. Not everyone can take anti-inflammatory medications though, and different surgeons have different protocols for cold therapy. So talk to your surgeon about what makes the most sense for you. And then there's scar tissue. Like I said earlier, scar tissue is inevitable to some degree, but there are ways to limit it. In addition to keeping inflammation low, the best way to do that is by doing physical therapy the right way. Good physical therapy comes down to three things. The first is timing. Most of your motion gains happen in the first 6 to 12 weeks after surgery because scar tissue hardens with more time. So doing physical therapy early is huge. The second is intensity. Gentle, comfortable movement usually isn't enough to get your knee to its full potential. So therapy has to be challenging enough to bring out all the possible motion. And the third is consistency. The progress happens in the exercise done between therapy sessions week in and week out, not just when you're working with your therapist. So let's bring this all the way back around. Does knee replacement improve your knee's motion? Sometimes a lot, sometimes a little, and sometimes it takes some motion away. Much of that is decided by where your knee starts and by the surgery itself. But the factors you can control are what help your knee reach the full potential it's capable of. If you want to learn more about how to maximize knee replacement motion, here are my top 8 exercises for the first weeks after surgery. I'll put another video on knee replacement motion here as well. If this video helped you, click the like button and subscribe for more knee replacement education. Stay well, and I'll see you in the next video.